Diseases in humans. Salmonella typhi is a pathogenic bacterium which causes typhoid fever in human beings. This pathogen generally enter the small intestine through food and water contaminated with them and migrate to other organs through blood, sustained fever 39 degrees to 40 degrees Celsius, weakness, stomach pain, constipation, headache, and loss of appetite are some of the common symptoms of these diseases. Intestinal perforation and death may occur in severe cases. Typhoid fever could be confirmed by the vital test. A classic case in medicine that of Mary Mellon, nicknamed Typhoid Mary, is worth mentioning here. She was a cook by profession and was a typhoid carrier who continued to spread typhoid for several years through food she prepared. Internova histolytica is a pathogen parasite in the large intestine of human which causes amoebiasis, amoebic dysentery. Symptoms of this disease include constipation, abdominal pain, and cramps. Stools with excess mucus and blood clots. Housefly act as mechanical carrier and serve to transmit the parasite from feces of infected person to food and food products, thereby contaminating them. Drinking water and food contaminated by the fecal matter are the main source of the infection. Ascaris, the common roundworm, Ncert, the filarium are some of the helminthes which are known to be pathogenic to man. Ascaris and intestinal parasite causes ascariasis. Symptoms of this disease include internal bleeding, muscular fever, anemia, and blockage of the intestinal passage. The eggs of the parasite excreted along with feces of infected person which contaminate soil, water, plant. A healthy person acquired this infection through contaminated water, vegetable, fruit, etc. Wucheria, W. bankruptcy, and W. malei. The filarial worms causes a slow developing chorionic inflammation of the organ in which they live for many years, usually the lymphatic vessels of the lower limbs, and the disease is called elephantiasis or filariasis. The genital organs are often affected, resulting in gross deformity. The pathogen is transported to healthy persons through the bite by the female mosquito vector. AIDS. The word AIDS for the acquired immunodeficiency syndrome. This means deficiency of immune system acquired during the lifetime of the individual, indicating that it is not a congenital disease. Syndrome means a group of symptoms. AIDS was first reported in 1981, and in the last 25 years or so, it has spread all over the world, killing more than 25 million persons. AIDS is caused by human immunodeficiency virus HIV, a group member of a group of viruses called retrovirus, which have an envelope enclosing RNA genome. The transmission of HIV infection generally occurs by sexual contact with infected person, by transfusion of contaminated blood and blood products, by sharing infected needle, as in case of intravenous drug abuser, from infected mother to her child through placenta. So people who are at risk of getting this infection include individuals with multiple sexual partners, drug addicts who have drug intravenous who take drugs intravenously, individuals who require repeated blood transfusion, and children born to HIV-infected mother. HIV is not spread by mere touch and physical contact. It is spread only through body fluids. It is hence imperative for the physical and physiological psychological well-being that HIV as an infected person not isolated from family and society. There is always a time lag between the infection appearance of AIDS symptoms. The period may vary from months to many years, usually 5 to 10 years after getting into the body of the person. The virus entered the macrophages where RNA genome of the virus replicates to form viral DNA with the help of the enzyme reverse transcriptase. This viral DNA get incorporated into the host cell's DNA and direct the infected cells to produce virus particles. The macrophages continues to produce viruses and in this way acts like a HIV factor. Simultaneously, HIV enters into a helper T replicate and produce progeny viruses. The progeny viruses are released in the blood, attack other helper T lymphocytes. This is repeated, leading to a progressive decrease in the number of helper T lymphocytes in the body of the infected person. During this period, the person suffers from bouts of fever, diarrhea, and weight loss due to decrease in the number of the helper T lymphocytes. The person starts suffering from infection that could have otherwise overcome, such as due to bacteria, especially mycobacterium, viruses, fungi, and even parasites like toxoplasma. The patient becomes so immunodeficient that he is unable to protect himself against this infection. A widely used diagnostic test for AIDS is enzyme-linked immunosorbent acid. Treatment of AIDS with antiretroviral drug is only partially effective. They can only prolong the life of patient but cannot prevent death, which is inevitable. Prevention of AIDS has no cure. Prevention is the best option. Moreover, HIV infection more often spread due to conscious behavior pattern and is not something that happens inadvertently like pneumonia or typhoid. Of course, infection with the blood transfusion person newborn from mothers may take place due to poor monitoring. The only excuse may be ignorance, and it has right said they are not die of ignorance in our country. The National AIDS Control Organization, NACO, and other non-government organizations, NGO, are doing a lot to educate people about AIDS, who has started a number of programs to prevent the HIV, ensuring the use of only this possible needles syringes in patients and private hospital and clinic. Free distribution of condom, controlling drug abuse, advocating safe sex, and promoting regular checkup for HIV in susceptible population are some such steps taken up. Infection with HIV or AIDS, having AIDS is something that should not be hidden, since then the infection may spread to many more people. HIV-AIDS infected people need help and sympathy instead of being stunned by society. Unless society recognizes it as a problem to be dealt with in a collective manner, the chances of the wider spread of the disease may manifold. It is a malady that can only be tackled by the society and medical fraternity acting together to prevent the spread of the disease.